Hi everybody, my name is Dr. Hilary Booth and I'm a naturopathic doctor, and welcome to my video blog. Today I want to talk about probiotics. So this is something there has been a lot of talk about in the media lately. You may have seen it in different yogurts that you can buy. You may see it in lots of different foods, and even MDs are starting to prescribe them in their practices. So I just wanted to give you a lowdown about what exactly they are, why we might need them, who might need them, and what makes a good probiotic, because not all probiotics are good or actually are going to help and make a difference in your body. So first of all, what are they? The World Health Organization defines a probiotic as a live microorganism which, when administered in adequate doses, confers a health benefit to the host. Now, I want to give you a little brief overview of why on earth we might be wanting to ingest live microorganisms. It sounds kind of crazy, but we do have bacteria alive in our guts. There are hundreds of different kinds of bacteria that live in there, and in all different amounts in different areas of your gut tract. And there are estimations that there are up to about 5 pounds of these bacteria that are living in your gut, and they're supposed to be there. They're helpful for you. So let's talk about how they can possibly vary from person to person. So the makeup and the number is influenced by your diet, the way that you were born, so whether it was a vaginal or C-section delivery, your mother's flora when you were in the womb, your genetics, your age, and whether or not you've been on antibiotics in your life, and different sorts of drugs as well can influence them. Now, why are they important and what do they do? So they basically line the entire gastrointestinal tract. They help with your hormone balance, including your mood. So they are heavily influencing what's called your serotonin, which is a neurotransmitter that's important for mood, as well as a lot of other functions in the body. They also help to balance and control your immune system. So this is a biggie. So people with inflammatory bowel disease, with IBS, with food allergies, with rheumatoid arthritis, thyroid disorders, frequent colds and flus, asthma, eczema, hay fever. As you can tell, I am rhyming off a lot of different things here. Most of them are autoimmune and or immune system mediated, and I'll talk a little bit about that in a minute. They can also help to lower cholesterol, and they can reduce your risk of colon cancer. So they're pretty important, and they can influence a lot of different diseases. So who might need to take a probiotic? The gut has probably, or your gut has probably not developed the way that it was intended to develop. And this is due to a lot of different reasons. We live in a sterile society now. We have hand sanitizers and antimicrobial soaps, and we don't let our kids eat dirt. We have an increased consumption of pasteurized and sterile sanitized foods. We have lower rates of childhood diseases because of things like vaccinations, which, don't get me wrong, I am fine with vaccinations. It's just, it changes the way that our bodies develop. And of course, we have an increased use of antibiotics, which when you take those, kills all the bacteria in your body, not just the stuff that's making you sick, but also the good stuff that should be there. So I want to talk a little bit more about the immune system. So the immune system, as everything else in your body, should be balanced. We have two different parts to it, one called Th1 and one called Th2. Now, in certain diseases, these are skewed one way or the other way. So in Th1 being high, this is where we see diseases like Crohn's, H. pylori, certain autoimmune conditions like rheumatoid arthritis, multiple sclerosis, and lupus. So if any of these are you, that's something to consider. You probably have a skewed Th1 immune system. If you have Th2 that's high, this is asthma, allergies, eczema, chronic fatigue, immunodeficiency, so if you're frequently getting sick, ulcerative colitis, and possibly some cancers. So basically, specific bacterial strains that are present in the gut influence the immune system to swing one way or the other way. So if you have an overrun of certain types of bacteria in the gut, you may be experiencing, for example, a Th2 skew in your immune system, and that can give you, this can cause and worsen things like, for example, eczema. So we want to supplement people the right way to bring these the Th1 and the Th2 back into balance. Or if you're not experiencing any of these symptoms, we want to make sure that we are supplementing a balanced probiotic and not one that's going to cause a skewing, because we don't want to cause a disease, obviously. And there's actually been some really interesting research done. There are 3 meta-analyses I want to highlight. One done in the British Journal of Nutrition in 2012, one in Pediatrics in 2013, and one in Epidemiology in 2012. All meta-analyses basically found that pregnancy supplementation with probiotics can reduce the frequency of childhood illness, reduce the frequency and occurrence of eczema, and reduce asthma in childhood, all of which are really common. So if you are pregnant or considering getting pregnant, that's something else to think about. Now, finally, what makes a good probiotic? So let's go back to that definition. So it's a live microorganism which, when administered in adequate amounts, confers a health benefit to the host. So first of all, it has to be alive. When you see probiotics on the shelf and they're shelf stable, this often means that they're choosing strains that will live at 22 degrees Celsius. This isn't necessarily helpful. Just because it can live at that temperature and it just coincidentally is room temperature, it doesn't mean that that's what your body does need, and it doesn't mean that it makes a good probiotic. So the ones that I prescribe are 99% of the time are going to not be shelf stable. They're going to be needing to be in the fridge until you take them. The second thing is to keep them alive, they have to be resistant to your stomach acid. Your stomach pH is super low. It's going to kill, it's designed to kill bacteria, right? You want to avoid food poisoning. The stomach is designed to do so. However, you need a probiotic that is enterically coated, that's going to be resistant to stomach acidity, and you need to take it with food to help bring that pH up a little bit so it doesn't just kill the entire probiotic before it gets into your gut tract. The other thing is that commonly seen probiotics on the shelves, like Lactobacillus acidophilus is probably the most commonly seen one. Again, aren't necessarily the ones that your body needs in order to be balanced and in order to be helpful. So the second piece was that we need adequate amounts of the probiotic, and so for children this should be between 5 and 10 billion culture forming units, and for adults between 10 to 20 billion culture forming units per day. Now, if you have recently taken antibiotics, if you've recently had traveler's diarrhea, if you suffer from Crohn's or colitis, this might be something that needs to be even higher for a short period of time to sort of replenish that gut flora. And then the doses I just gave are more of a maintenance dose. Now, the other thing is they need to be in multi-strain form. So if you're going to take one strain of a bacteria and put that into your body, you're going to overload your system with that kind. What we want is to have a variety, because that's what naturally exists in the gut, is a variety of different bacterial strains. So the third World Health part of that definition was that it confers a health benefit to the host. So if you have a Th1 or a Th2 skewed system, we need to make sure that we are giving you benefit by supplementing the right strains of those probiotics. And the other thing is, if you do have a balanced system, but you just don't have enough, you've taken antibiotics, you get sick frequently, that kind of thing, we need to just make sure that you're getting an overall balanced probiotic, which surprisingly enough is really hard to come across. A lot of them are skewed without meaning to be. So you need to make sure that you're getting a balanced, live, adequate amount of probiotic in order to be getting these health benefits from them that I mentioned earlier. So I hope this was an informative and helpful video blog for you. If you have any questions, please go to my website, www.hillarybooth.com, and fill out the contact page there, and I'd be happy to answer any questions. Of course, you can always go to my website and book an appointment with us, book an appointment with me online, or you can phone the office and book an appointment there. Thanks very much for watching, and I hope you have a great day.